This week, Donald Trump's State of the Union address put Minnesota back in the spotlight, and Hennepin Healthcare says it stands to lose nearly $2 billion over the next decade. This is the February 27th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
President Donald Trump delivered a 108-minute State of the Union address this week, but only spoke to healthcare issues for a few minutes, focusing on drug prices.
Under my just enacted most favored nation agreements, Americans who have for decades paid by far the highest prices of any nation anywhere in the world for prescription drugs will now pay the lowest price anywhere in the world for drugs, anywhere, the lowest price.
Trump also vowed to enhance what he called price transparency, apparently making reference to hospital price regulations he enacted in his first term, although he didn't offer any new details in the address.
The president this week also named Vice President J.D. Vance to head what he called a war on fraud, specifically blaming Minnesota's Somali community. Vance suggested in a Fox News interview last weekend that federal officials may seek what he called reparations from the state for what the White House says is $19 billion in fraud. So far, criminal charges have alleged about $550 million in public funding has been stolen through social services fraud since the pandemic, according to the Star Tribune. Vance took action quickly and announced the federal government would suspend $249 million in Medicaid social services reimbursement solely from Minnesota. Federal officials said Minnesota could cover the federal share, which would amount to $1 billion in 2026, with its own state reserves. Minnesota's Human Services Commissioner Shireen Gandhi called it part of a sustained attack on Medicaid.
And a new coalition of nonprofits that serve Medicaid beneficiaries gathered at the Capitol this week to urge lawmakers to do what they could to protect Medicaid in Minnesota as clawbacks and cuts loom in Washington. This is Medicaid represents healthcare and social service providers who say cuts and clawbacks will take a serious toll on some of the most vulnerable Minnesotans and the providers that care for them. Winona Health CEO Rochelle Schultz said that half of the 8,000 people insured by Medicaid in Winona County and 80% of the births at her hospital this year were covered by Medicaid.
The patients that we serve are low-income mothers, their children, grandparents in nursing homes, veterans, and people who are working folks but just don't have access to health insurance. And when they lose their coverage, that doesn't mean they don't need care. It just means they're going to probably show up in our emergency room and likely in a sicker state.
Schultz also said that a single worker handled Medicaid applications in Winona County and that looming new work and enrollment requirements would likely cut Medicaid for coverage for years to come. Also in St. Paul this week, the legislature turned its focus to health care around the state, starting with the $193 million in federal Rural Health Transformation Program funding that Minnesota won in the first year of the 5-year program. The Minnesota Department of Health's Zora Radosevich said 94 Minnesota hospitals would be getting funding in 2026.
There will be restrictions on how funds can be spent. There are some unallowable uses. One that was very clearly made to us is that the Rural Health Transformation Funds can't be used to offset Medicaid losses.
Minnesota officials have estimated the state will lose $200 million a year, potentially totaling $1 billion because of an expected decline in eligibility for Medicaid through 2030. Hennepin Healthcare also offered a presentation to the Minnesota Senate this week, laying out HCMC's dire finances. Hennepin County Commissioner Angela Connolly told lawmakers that an immediate $50 million shortfall was only the tip of a financial iceberg looming ahead of the hospital, one of the state's premier trauma and burn centers.
HHS is set to lose an estimated $1.7 billion with a B over the next 10 years.
Connolly said that figure is a combination of a pullback of federal matching Medicaid funds for Hennepin Healthcare services and also unpaid care for people expected to lose Medicaid eligibility. Connolly also told lawmakers that the hospital provided $25 million worth of unpaid care to residents outside of Hennepin County in 2024, part of the reason property taxpayers had to contribute $38 million in subsidies to Hennepin Healthcare last year. Connolly and others urged lawmakers to authorize a 1% county sales tax to shore up Hennepin Healthcare. Republican State Senator Paul Utke of Park Rapids said Hennepin Healthcare wasn't alone.
They're in a serious position, but we've got others. They're losing big dollars, and we can't afford to lose a single one. So, Madam Chair, I hope that we can have at least another hearing just directed to the financial viability of our hospitals.
Also at the Capitol, Minnesota Attorney General Keith Ellison announced that Minnesota was one of 14 states joining a federal lawsuit alleging the U.S. Department of Health and Human Services and the CDC improperly fired all members of the nation's leading vaccine advisory committee and rolled back recommendations for hepatitis B, along with 7 other childhood vaccinations. Just days after that filing, the Star Tribune reported Minnesota has tallied 10 cases of measles in the first 2 months of 2026, nearly half the total for all of last year. Minnesota Department of Health data shows vaccination rates for kindergartners have fallen by 7% over the last decade, and only a little more than 5 in 6 kindergartners are starting school fully vaccinated.
And finally, a bright spot for Minnesota this week. Newsweek magazine named Mayo Clinic the world's best hospital for the 8th straight year. The annual Newsweek rankings are based on patient survey results, an international survey of more than 85,000 healthcare professionals, and metrics like patient safety and quality of care. And that's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.